Welcome back. Well, the Medicare annual enrollment period is open until December 7th. And today we are going to debunk some Medicare myths and answer some frequently asked questions you may have. Brian Vranek is with Network Health and J.J. Kravit is an agent with FHK Insurance. And they're going to guide us through some of the truths and myths of Medicare. Good morning to you both, gentlemen.
Thank you. Good morning.
Thanks for joining me today. Okay, let's talk about this first because I want to hear about the Medicare Advantage plan with 0 monthly premium. Is that too good to be true?
Well, first, we want to say thank you very much for having us on this morning. It's a pleasure to be able to speak with your viewers. And to answer your question, no, it's not a myth. It's absolutely true. At Network Health, we work with Medicare directly, and that gives our members the opportunity to have a 0 premium per month plan. It's awesome. You just pay a small fee or a copay when you utilize your benefits to go in to see a doctor or have something done. So, and those small fees are called copays, right? Mm-hmm. And so our plans can be also named pay as you go, if you will, because you're only paying for the services that you need at the time that you need them, rather than having to pay a large monthly premium and not actually use your benefits. So that's saving our members money every single month. That's important to them right now.
That's so true. I mean, money in the pocket can make a huge difference when you're trying to stay in your home or you've got other things that you need as well. Let's talk about the next common myth or not that people wonder about, and that's if they're enrolled in a Medicare Advantage plan and that did not meet their expectations, they can't just switch plans, can they?
Yes, they can switch plans. Currently, we are in the annual enrollment period that starts October 15th to December 7th. And during that time, you can really switch plans as many times as you'd like for a January 1st, 2021 effective date. And on top of that, this year, they're going to have the open enrollment period again, which gives you an opportunity to change your Medicare plan again between January 1st and March 31st. So there's always Medicare beneficiary rights out there and some flexibility. So you're not stuck in the plan.
All right, that's good to know. The next one people wonder about, and maybe this is for you again, JJ, but if you use an independent agent to consult and help you, don't you have to pay that agent?
No, you do not have to pay for our services. When you work with an independent agent, what you get is a one-on-one experience with a local Medicare expert who is independent, represents all the plans out there, and at no extra cost. And so it's really important when you're evaluating your Medicare needs to work with the Medicare expert and to go through on a one-on-one basis your individual situation.
Okay, what about this one, you guys? People are going to wonder about dental, vision, and hearing. Those types of benefits, are they included in Medicare Advantage plans? They're not, are they?
Well, actually, it depends. Many Medicare Advantage plans actually include these additional benefits, and they're called supplemental benefits. And if these benefits are important to you as a Medicare member, you want to make sure that the company that you're working with has plans that do include that. Now, some plans like Network Health also includes a reimbursement program, which I'm really excited about this year because it's brand new for one of our plans for 2021. And this reimbursement program is called Pick Your Perks. And what that means to you as a member is if you need dental, we have a reimbursement that will reimburse you for those expenses. If you need glasses or contact lenses, we can reimburse you for those expenses. If you use acupuncture as an example, we can reimburse you for acupuncture. We have over-the-counter benefits as well. These are all supplemental benefits that are included in our PPO $0 plan. So it's a great benefit for people who are looking for those types of extra benefits. Pick your perks. So you definitely want to remember that. And the part of advantage or the advantage of a Medicare Advantage plans is that we have these additional benefits available to you.
Well, I think that's why somebody needs to learn so much more, you know, because who doesn't need glasses? Who doesn't need help with their teeth? Who doesn't need, you know, potential hearing aids, right? I mean, especially as we age, those are all the things that go. We need some coverage for that. The next question that I think most people have, and so I want to either have you debunk this or not, is what about having to go to specific doctors? Staying in network with your Medicare Advantage plan, isn't that the only option?
No, it's not the only option, Tiffany. Let's debunk that myth. So with an HMO, a health maintenance organization, these plans, we need to stay in network. The doctors would have to accept the terms and conditions of the plan, and there's not going to have any coverage for out-of-network doctoring. But for PPOs or preferred provider organizations, you have access to out-of-network doctoring. And if you go out of network, there might be some extra cost sharing or be a little bit more expensive over the in-network doctors, but you have the access to doctor out of network.
You guys are great. I feel smarter. I hope everybody at home does too. Brian and JJ, thank you for joining me this morning.
You're welcome. Thanks for having us.
Yeah, good to see you guys. All right, remember, the Medicare enrollment period ends December 7th. To find and compare Medicare Advantage plans for those sorts of benefits, plan to visit the website, which is networkhealth.com.